All right, good afternoon. Thank you so much for joining us today for Our Health's Lunchtime Live. My name is Amber Van Niekerk with Our Health's marketing team, and I have the pleasure of being joined today by Dr. Jessy Thomas of our Health practice in New Brunswick. Dr. Thomas and I are going to talk a little bit today, primarily Dr. Thomas, but talking about managing stress. And we all know this is such a stressful time, so we're going to be talking about some tips and tricks for that, some signs of managing stress. But before I get started with that, just wanted to take 1 minute to briefly talk to you about Our Health and who we are. So if you're not familiar, Our Health gives you access to a personal doctor on demand. And one of the great things about Our Health is if you have New Jersey state health benefits, there's no cost, no changes to your health benefits, and no copays to see an Our Health doctor for your personal primary care. You will see at the bottom of our screen that our website and phone number are scrolling, so you can get some more information there. But without further ado, just wanted to, again, thank everyone for coming. If you have questions, don't forget you can post them in the comments. And now let's get started with Dr. Thomas. So Dr. Thomas, good afternoon. How are you doing today?
Good afternoon. I'm doing very well. Thank you for asking. How are you?
Great. Thank you so much for joining us today. I know that, as I was mentioning, stress is such an important topic right now. So let's talk about that. So, why is managing stress so important in general? And also, what's different right now?
Sure. So great question. So right now, given everything going on with the pandemic, as much as we're fortunate in here in New Jersey, but not everyone else is as fortunate that, things are coming down here, but the after effects are still in play. And so people are still afraid for their health, their safety. There's still a lot of stress, financial stress, and really balancing homework, home life and work life. Especially with working from home, a lot of patients don't get out as much, and so you get a little bit of cabin fever. So there's a lot of different factors that are impacting our lives today. So it's really important that we manage it, and it can affect you from head to toe. So that it's important to recognize the signs and intervene when necessary.
Yeah. Yeah, it's so important. And I'm sure you're seeing, are you seeing an increased amount of, stress in your patients right now? Are you seeing, there's more stress, anxiety, other issues?
Definitely. I don't jump to label. I'm seeing a lot of situational stress and anxiety and some depression. So a lot of mental health effects due to that, but very situational.
Hmm. And what are some signs of stress that we should be looking out for?
So just as I mentioned, like it can affect you head to toe. So some people will start to recognize their stress levels increasing because of signs of anxiety. So the shortness of breath or palpitations, but there are other signs. I've had several patients with headaches, and they think they have new onset migraines or some other cause for headaches, but it's actually tension headaches due to the strain and tension of working from home in a non-ergonomic environment, or this just mental stress and causing tension headaches. Otherwise, it can change your sleep. So lack of sleep or increased sleep can be an effect. Change in interest in your hobby. Say you normally like gardening, but you're scared to go outside because of all the stress of everything. You're losing interest in that. Change in appetite, GI issues, like I said, head to toe. So there can be a lot of different things. Mm-hmm.
And, we talked about, as we were prepping for this session, that there are some simple techniques that we can use to manage stress, to really help us de-stress, calm down. So will you share some of those with us?
Absolutely, I'd be happy to. So my favorite is meditation. So I kind of lump meditation, prayer, breathing exercises all together because everyone's different. If prayer works for you, great. I like to separate the two. And so I like having a special time just for meditation, because it gives me a time to sit and reflect and check in with my mind, with my body, and just some moments of quiet, if you will, so to kind of talk through things. And it is, depending on, what your background is. If you have training in it, then great. But I like using different apps. I know a lot of our colleagues here in Our Health like to use the Insight Timer. I have several patients that like the Calm app. Headspace is running all kinds of specials as far as during the pandemic. Healthcare providers are, because of the mental strain we're under, get a discount. There's anyone who's unemployed currently, I believe, can get Headspace for free for, don't quote me, but I think it's a year. And then Simple Habit is another one. And they're guided meditations, really beautiful things. But also, I like using some of them while I'm working because they have kind of these musical renditions that focus you. And when it seems like work is piling up and you're never going to get to the end of it, it's nice to tune everything out and just kind of listen to just not relaxing music, but focusing music. So these apps have a lot of different modalities and resources within them. So going back to the meditation, though, they have several exercises for guided breathing exercises and things. So that's by far my favorite. My close to the favorite, my number 2 is physical activity. So I am not someone who goes to the gym a lot. I'm not going to pretend to be someone who is very religious about going to the gym and working out. But for someone like me, you can find a lot of different activities that can reduce your stress. I do like to do like a high intensity workout twice a week to really just let out all the pent up tension. But then I also like to do yoga. I have my yoga mat here in the office. So once in a while on my lunch break, I'll roll that out and do like a quick, like 10-minute session of yoga. And just to stretch things out, again, going back to the muscle tensions and things, it kind of just relaxes you and releases that tension. You can also do just a leisurely walk. I tell patients all the time, something is better than nothing. So don't scoff at a 5-minute, 10-minute walk. My neighborhood is small, so 5 minutes, I'm already at my neighbor's house. But that 5-minute walk, you take in the fresh air, the beauty of your surroundings, it can be very relaxing. So those are, and I'm just mentioning a few, whatever your hobbies are, whether it's, playing a little sports in your backyard with your family or something, like you find what's useful for you and works for you in your household. So that's number 2. Number 3, I do suggest to some patients who, they're getting really down and the stress is really burdening them and they are having trouble getting it all out, or they don't feel like they have enough resources to get it all out. So one thing that I do suggest sometimes is write it down, get a journal, or it can be something really normal. It doesn't have to be a fancy journal. It could be something from Target, but I do suggest a couple of questions to ask yourself when you're doing these journals, and to help put things in perspective and make sure you're prioritizing what's really important in life and seeing how that plays a role into your life. So one being, what are your passions in life? So if you acknowledge those passions, and then number 2, what gives you meaning and purpose? So now you're identifying the things that you're passionate about, what fulfills you, And then number 3, who's important to you? Are you making time to speak to them? If during the pandemic you might not be able to see them, but you can do video calls. You can do a phone call. You can write them an email. Find a way to communicate with them. So now you have these 3 questions, and you have the answers to these questions. How can you incorporate this into your life? So number 4, how can you structure your day so that you can incorporate these passions, the things that give you meaning, the people who are important to you? And once you've incorporated those things, how does this stressor in your life fit into that? Now, I'm not trying to minimize anyone's stressors. And they're very real and significant. But how can incorporating these things into your life, or prioritizing these things, how can it positively affect how you deal with your stress? Right? So these are just some points. You don't have to do this, but sometimes it just helps to write things down. Me personally, I like to write. Typing is great, and I'm proficient in technology, but something about writing down a list for me is really helpful. It helps me structure my day, especially my days off. I typically have a to-do list, and it helps me prioritize, okay, what do I need to do? And then the tension's not there, like, oh my God, I have so much to get done. No, okay, this is manageable. I'm going to get this stuff done in the morning, this done in the afternoon. The rest can wait till the weekend or next weekend. And then like that tension.
But doesn't it also feel good to just check something off of your list? I feel like there's something to that too.
Absolutely. There's you can't replace that feeling, like checking that off. I have a friend who just crashes it out. So definitely.
Okay, so we have meditation, physical activity, journaling. So what other things are in that top 5 list?
Yeah. So number 4, I would say, is treat yourself. Okay. So this is where finances may play a role, but it doesn't have to. I've gotten really creative at home. Sometimes I'll do, look up some at-home facial recipes where I make a concoction with just common household things, whether it's honey or turmeric or something that I have in my cabinet, and make like a mask, or you could do something a little bit more pricey, like an indulgent treat. Like New Jersey has tons of great bakeries and things, or making your own, or treating yourself to a massage, or involve your family. Like your partner could use like a handheld massager and apply a little more pressure. Little things like that. Taking that time for yourself can really make you feel like, okay, things are not so overwhelming. I have now indulged myself a little bit. I used another example with someone, you might buy something that's a little more indulgent. Like if you buy, a drugstore nail polish, normally you could indulge yourself a little bit and spend a little extra money. It might be a $20 nail polish, but hey, it's in the grand scheme of things, $20, and it made you feel like a princess. Then it's kind of worth it,
We all need that, right? We all need to treat ourselves every once in a while.
Yeah. For guys, like, treating themselves to a nice, I don't know, like a flight of beers or something, like something indulgent, can kind of help perk you up a little bit. And then the last one would be hobbies. So I have a lot of patients who did this. They found a new hobby. So I know within our group and within our health, a lot of people have gotten into gardening. So that's always good. And that's a healthy choice, right? You get nice fresh vegetables from your garden. Technically, they're organic, and then I have some patients who've gotten back into reading. So they've got a ton of books. I personally have a stack of books on my nightstand as well. I have one patient who put me on, and I think I shared this with the group, diamond painting. That was pretty interesting and cool. So she made these beautiful paintings out of little crystals or something, and you know, explore whatever you want to get into, you know, explore it. I'm also into baking, so I was looking for new recipes. I concocted my own healthy fudgy black bean brownie recipe by combining a bunch of recipes. Yeah. And you can't even tell that black beans are in it.
I think
So,
some of these things we're going to have to share with the group on our Facebook page after this. Ask Dr. Thomas, the at-home facial and the black bean brownies.
Yeah, definitely, definitely. So yeah, and then yeah, I mean, I have a ton of DIY stuff. I got back into making my own body cream, and I made an eczema cream for my daughter. So there's all kinds of stuff that can fill your time and kind of release that. Like by the end of it, you've created something, or you've accomplished something, and that's a good feeling. That really helps the spirit, you know, elevate you and help you feel better and kind of reduce that stress.
Okay, I'm going to pause there before we move on, just to see if anyone has any questions. You know, please share.
Mm-hmm.
I'm going to pull up my phone too, because I don't think our questions are showing on my screen. So bear with me 1 second, just so I can make sure
Oh, sure.
that we're seeing the questions that are coming through. While I do that, Dr. Thomas, while I look at the questions, and I want to make sure we're getting to people's questions. But you know, just if you wanted to just take a moment and also just talk to us. You know, we hear a lot about mindfulness lately. I know it's something that, you know, I hear a lot about personally, that we talk a lot about. You know, what role does that play in you know, in helping to manage stress?
Sure. So great question. So first of all, mindfulness is, you know, a mental state, right? Where we're more aware of the us in the moment. So it helps to kind of shut out those stressors. Going back to number one, the meditation and breathing exercises, it helps to kind of shut out all the stressors and really focus on being present in the moment and making and checking in with your mind and your body, making yourself more aware of what's going on with you in yourself, and that helps kind of diffuse those some of those physiologic symptoms. So if you're having palpitations or short of breath, checking in and being mindful in that moment can help slow down that breathing rate, that heart rate, and kind of reduce the tension.
And the question that we got, sorry, apologies, as I'm looking at my phone, is, you know, how is mine? It's actually a question about mindfulness, which is interesting, since we were just talking about that. But sort of, you know, how does, you know, some of the apps that are available for mindfulness or yoga tie into mindfulness, and, you know, and sort of really sort of, how does this all fit together?
Yeah. So I mean, in maybe I should get a little clarification. What do you mean? How does it fit together?
So basically the question is, just summing it up, are, you know, meditation and yoga connected?
Oh, yeah, definitely. So yoga, there's all different types of yoga. You know, there's more spiritual kinds, where you're doing more chanting and things like that. There are some that are just checking in, you know, they're not so intense. Some of them, you know, like hot yoga, and some of the other ones are much more intense. And those are great. I love doing some of that too. But sometimes you need something to kind of wind down, or wind up, kind of like wake yourself up in the morning. And those are like sun salutations are great to first thing in the morning. And so it helps you kind of check in with your body. I love using different yoga clips, yoga videos on YouTube. And some of them are great at guiding you through some mindfulness moments before and during the yoga session. So yoga in and of itself helps you be more aware of your muscles and joints and stretching out things that you may not normally stretch. and helping you be more aware. So they can be interconnected, definitely.
Mm-hmm. Great. What about sort of, if a patient said to you, what is the number one thing that you would do to manage stress? Your go-to stress relief. What is that?
So I do a little bit of everything, but I would say my go-to is definitely the meditation, because these apps, they're designed to have just 5 minute, 10 minute. You can make it longer. You can extend it to 20 to 30 minutes. But those five, like that is such an attractor for me. 5 minutes. I can take 5 minutes during my lunch break or in between meetings or in between patients. I can take 5 minutes for myself to reduce my stress.
Mm-hmm.
Yeah.
Okay.
So that would be my go-to.
So, when you and I were talking about this yesterday, we were also talking about life changes and how, different things happening in our lives can really sort of be triggers for stress. So can you tell us a little bit more about that too?
Absolutely. So yeah, and whenever a patient comes to me saying that they're anxious or depressed or they don't know what's going on, say they're coming in with one of those symptoms, hey, my heart rate's been going fast, I'm getting a lot of headaches lately, I can't sleep. The first thing I usually ask them is, okay, what's going on in your life? What kind of stressors are going on? So life changes can include, let's say you got married, let's say you got divorced, let's say you moved. And oftentimes when you do marriage or divorce, you're moving too,
Mm-hmm.
or a new job. All those things can be major life changes. And if you really go delve into each one, you see how it's stressful planning a wedding, right? There's so much coordination. Even if you have help, there's so many decisions to be made in going into planning that wedding. And then at the same time, if you're moving in with your partner or moving, you're together and you're just moving to a bigger place or something like that, you're now coordinating how to pack up each of your things and putting two households together. Has there been a death in the family? And it could be something that was recent, but it could be something that you just haven't dealt with recently. Despite it happening. So it could be a death in the family, and months later, you're still feeling that pain, and it's still weighing on you, or the after effects. Maybe that loved one had several things that needed to be dealt with, property or finances or things like that. So there can be after effects to all these things. And then a new job, that getting your feet wet, getting involved in that new job, getting used to the new environment, coworkers, things like that. And some of these things could be good things. They're good stressors, right? Everyone's excited to start a new chapter in their life. So it could be good stress, but there's a happy outcome. There's a light at the end of the tunnel, but sometimes you're just stuck in that tunnel, and that stress really gets to you. So it's important to recognize, okay, I'm going through a life change. I need to recognize it and have an intervention, whether it be a 5-minute meditation, whether it be, let me start doing a workout to diffuse that stress, at least a couple times a week, those kinds of things.
And I would also say, talk to your doctor, right? You're dealing with something and you can't figure out what it is, that your primary care doctor is there as a resource, right?
Absolutely. You read my mind. So that would be number 6. So, that's what we're here for. Talk to us. I love giving customized advice, and I'm happy, especially if with our health and the model that we have, I actually have time to look things up for my patients and have this discussion. Some of my patients, whether they have anxiety or ADD, or say, they have a child with some issues, I can find like, hey, let's I have some books. Let me look it up, check some references, and I'll send you a list of books that might be helpful. Or actually one of my patients put me onto restorative yoga. So now I've actually started using that, suggesting that to other patients for PTSD and trauma. So yeah, definitely call us, sign up on the link down below, call us, and we'd be happy to help you sign up, and we can discuss these things.
Yeah. Great. And I have another question. Again, I'm just glancing over at my phone. Apologies to look at it, but just wondering how stress presents differently in men and women. How does it affect men and women differently?
Sure. Everyone's different, whether they're male or female. Some men are different from other men. Some women are different from other women.
Mm-hmm.
But I would say, in general, women can sometimes take it out on it'll like affect them in their family life, or it can affect them at work, things like that. Men, sometimes they hold it in, or they'll have outbursts as well. So they can have different things. I would say if I feel like more than the differences between men and women, it depends on your like medical condition. So for a patient who's diabetic, for example, their sugars may go up. So that can be a stress, because the stress hormones are now elevating, the cortisol levels are now elevating, and can affect their blood glucose levels. If it's a patient with high blood pressure, guaranteed their pressure is going to be a little bit elevated. I've seen countless patients, though, when they're in pain, they say, let's not jump to conclusions and start you on increasing your medication. You're in pain right now. Let's treat the pain. Let's go from there. Let's treat your anxiety, and let's go from there. Let's see what we can do to fix the source. So I think that would be more of a differentiating factor, what kind of medical conditions they have.
Mm-hmm. So it sounds like that stress plays a really big role in overall health too. Is that correct?
Absolutely. It can infiltrate every part of your life, every part of your body. So I think early intervention is ideal and can be really helpful. So trying these things at home is great, but again, it's important to reach out to your doctor and say, hey, I'm trying these things, what do you think? And sometimes I might come up with something else. I think sent a list of herbal teas to a patient, and said, why don't you try something natural, like chamomile tea, valerian tea, things like that. I know Our Health has featured some tea recipes as well, which I've been eager to try.
So sometimes it's not just prescribing, counseling or a medication. It's really just thinking out of the box, right?
Absolutely. I'm trained in prescribing medications, right? So I know what to do in that regard, but that doesn't always have to be the answer. There's always other things that we can try. There's supplements like L-theanine that's known to be good at reducing stress and helping people with their sleep. There's all kinds of things. So, and then there's also different medications out there. It doesn't have to be the classic benzodiazepines, like the addictive stuff. Although there's a time and a place for those. But it doesn't have to be a prescription medication. It can be something that you need a new routine incorporated into your life.
Okay, we are wrapping up. We're getting close to 12:30. So before we end, just any final advice you'd want people to know, any sort of last tip, when thinking about managing stress.
Yeah, one point I want to make is, remember that stressing out does not help with the outcome of the actual issue that's stressing you out, right? So whether it be your health and safety, whether it be finances, work life and home life balance, stressing out and freaking out about it isn't really going to help the situation, right? It's more helpful to look inside and see what can I do to reduce my stress and how can I approach this differently. Because when you take that moment of insight and reflection, chances are you're going to approach it a little bit differently and think a little bit more clearly, and you're going to feel better. So health-wise, mentally, emotionally, everything.
So really just taking a moment and processing things.
Absolutely.
Great. Yeah. Well, thank you so much, Dr. Thomas. I really enjoyed talking with you today. I know I've learned some new tips that I could use personally. I hope everyone who joined us did too. Again, just a final reminder, if you're interested in learning more about our health, again, you can visit our website or call our phone number that are listed on the bottom of the screen. Thank you, Dr. Thomas. Thank you so much, and I hope everyone has a great day.
Thank you, Anne.